leading senior orthopedic consultant from India, talks about his education and experience. He worked in England for 11 years and has had many papers published in international journals.
I trained in India initially and did my post-graduation along with my undergraduation. I then went off to work in England, where I worked for over 11 years. I have hence got my qualifications from England, which includes FRCS and the FRCS in Orthopedics. I also finished my surgical training in UK, which is the common European register for which certifies me as being able to work and operate anywhere within Europe itself. I have attended many international conferences, both in Europe, America, as well as in India. We've also organized a lot of arthroscopy, arthroplasty conferences within India itself. In fact, in the next few days, you're going to have a shoulder conference on a similar theme. My publications are there in clinical orthopedics and some other journals of international repute. My main interest as far as orthopedic surgery is concerned is to do with adult joint reconstructive surgery, which basically includes joint replacements of hip, knee and ankle. I also do a lot of work on deformity corrections, including the use of Taylor spatial frames. My other interests are foot surgery and hand surgery. In foot surgery, because of my previous training, I do a lot of hallus valgus, which is the bunion surgery and correction of deformities in the feet, and also surgeries involving rheumatoid feet and paralytic feet. I've been practicing in India now for about 3 years, where I've done very well and have had a lot of patients come from almost all over the world. Our major concentration seems to be coming from parts of Asia and Africa, but we've always had some patients regularly coming in from the United States of America, and within India itself we get patients almost from the whole of the northern part of the country have come to us for treatment in various problems. Prior to moving to India about 3 years back, I stayed and worked in Newcastle upon Tyne in England and in Bristol, in the Bristol region. I worked in say somewhere about 12 hospitals in these places. My experience there was initially as a trainee, and then becoming a registrar, and then followed on with that with fellowships in hip surgery, knee surgery, and deformity correction surgery for the lower limbs. One of the reasons for our success working as a unit in this hospital has been getting together of a group of like-minded individuals who've complemented each other because of their different training backgrounds and different training interest. Because of this, we actually cover the whole spectrum of orthopedics. And not only that, because of our different backgrounds, we actually complement each other with the deficiencies that one person might have. So our strength lies in being able to work together, in fact operate together at most times, and also a cohesive atmosphere in which all of us actually discuss and debate over cases with a very open mind, rather than having a didactic approach to any patient. Essential thing for most successful surgeries is good decision making. Most of the surgeries themselves are actually not that difficult, and what we do try to do is give a very comprehensive assessment to the patient, so that they can be assessed properly and get the proper treatment. Even at the end of the treatment, the contact with the patient is maintained throughout. We all access our emails regularly. We regularly keep on sending feedbacks to the patients and getting feedback from them regarding what they should be doing. It's not happened very often, but once or twice that's happened, that people have come back to us with some problems or something. We've always had a very open attitude to actually sort out their problems. So it's not the end of the treatment when we come to giving a treatment once the operation is done. It's almost a lifelong association that we build with the patient.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.